Okay, we have our patient standing on the table, and to go into ventral recumbency, we're going to grab our hand around and then just hold the side of the body. For ventrodorsal, we're going to take the front paws, push them forward, and the back paws you're going to extend. So then we have them laying completely down on the ground. And then in this position, we can, with our front hand around their neck, we can grab their front paws. And then with our free hand, we can take their back paws. And at the same time, we're just gonna roll them over. So then they're on their side, holding their belly. You're gonna move your arm. So then you still have their head, but you have their paws with your finger in between each paw. So then it's nice and comfortable, and that's our lateral. And then flipping them all the way over onto their back. You can hold their belly here and place your arm underneath their neck. And then we've got dorsal. Then if we grab all of those limbs again with our fingers in front, we've got our ventrodorsal. And then placing them back down, we can put them standing up again. And we'll grab them here. And we'll have one arm out. So I can grab it with this arm. And then we can grab our clippers, our nail trimmers. And we're going to just get the hair back out of the way. Push down so then the claw comes out more, and in a downward motion, you're going to clip the nails slowly until you can see the black dot, which will indicate that you are at the quick. And then for a physical exam, we're going to have our patient like this, and we're going to grab our thermometer and some lubrication, and we're going to place that in the rectum and wait for our temperature. While we're waiting for our temperature, we can do the beats per minute. So we're going to go right underneath their arm, and we're just going to hold that there for 15 seconds and count. So I got 25 beats per minute, so we're going to multiply that by 4, which is 100 beats per minute. And our temperature here says 102.5. And then we're going to do our respiratory rate per minute. So we're just going to put our hand on the left side of our patient. And we're just going to feel their lungs go up and drop. Or not their lungs, but we're gonna feel their body go up and drop with their breaths, and we're just gonna count for 15 seconds. So I got 5, and we're gonna multiply that by 4, which gives us 80 respiratory breaths per minute. And then for a physical exam, we're going to look in the ears. We're going to look at the eyes, we're going to look in the mouth, the gums, teeth, the tongue, and then we're going to look at all of the limbs, make sure that they work properly, there's nothing stiff. We're going to go down on the back and make sure there's no lumps or bumps. It's very soft. Okay, for restraint for a cephalic venipuncture, we're going to have them in a sternal restraint. So we're just gonna have their head locked, and then we're gonna bring their one arm forward, the one that they're gonna use to puncture, and you're just gonna hold it just behind the elbow. And for a jugular venipuncture, you're gonna have the same sternal restraint, but we're gonna hold more up And then hold the side of the body just to see if they're gonna have any movement. You can use your chin if they have a lot of head shaking. Just kind of hold them there and then make any slight adjustments that you need as per the DVM. For our saphenous vein, we are going to go into a lateral recumbency. So we're gonna grab, roll our patient, grab the paws, and we're just gonna hold them down with our forearm for their neck. And we're gonna make sure that their legs are nice and separated with our fingers in between. And then the puncture is gonna happen just in between here. So you're gonna make sure those back legs are nice and stiff. For the cone, I don't have a cone with me, nor can I find something that resembles a cone. So to build the cone, it's gonna come out flat, and then you're going to make it into that cone shape, that circular shape, and you're gonna put the tabs in the inside and out the outside, and you're gonna do that twice, and then put the tab in the secured spot so then it doesn't come loose. You're gonna do that 4 times around the cone, so then it's nice and secure. When placing the cone, you wanna make sure that the cone doesn't get too squished up towards the eyes. That means the cone is too big. A cone that's too small is a cone that is smushed up against their snout and that you can't fit any fingers in the side. A perfectly fit cone would be I think I was doing, that ain't it. You want a cone that'll fit around their neck, as well as it'll be long enough that their muzzle doesn't come out of the cone, so then they can't lick or bite or any of that. So the cone going around their neck, you want it to be just as tight as their collar, so then you can still fit 2 fingers in between so they can still breathe. And then you can either use a bandage to put inside the cone loops, or you can use their collar. If you're using the bandage technique, then you're gonna put it around and then you're gonna tie a knot at the back so then they can't undo it. With the collar, you just put the collar on and done.